Hello, I'm Larry Holden, President and CEO of Global Liver Institute. We want to welcome you here today for an important policy briefing for our Liver Cancers Department. As October begins, it is my pleasure to welcome you here and join us in our annual October is for Livers campaign as we focus on liver cancer and the ways that we can help those patients. Throughout the month, GLI is dedicated to driving health equity by engaging diverse communities around the world, pushing boundaries, and fostering greater understanding of the liver community. With that, it is my esteemed honor to welcome Sarah Van Gutruden of Thorn Run Partners. She brings with her a vast wealth of knowledge and experience in the healthcare field and is a valued partner for the Global Liver Institute. Thank you for joining us today and being part of our campaign.
So thank you, Larry, so much for that kind introduction. My name is Sarah Van Gutruden. I am a partner at Thorn Run Partners and have been advising Global Liver Institute for about a year and a half now, and just excited to be here. You have a lot going on, and this has been a particularly active year. So there's a lot to cover today. I'm excited to get started, and always, when this is done and it's over, if anyone ever has any questions, please feel free to reach out to anyone on the GLI team, and we will try to get you some answers. So I'm going to go ahead and get started. So again, I work with Thorn Run Partners. We are a government affairs shop that provides counsel to a lot of different types of clients. We have Republicans, we have Democrats, so we're nonpartisan. But our goal here really is to make sure that you have a voice in the policies that are being debated on Capitol Hill. So I'm going to start with one that I know is top of mind for a lot of folks, the Treat and Reduce Obesity Act. We also call it TROA. Global Liver Institute for a long time has been part of coalition efforts to advance coverage for obesity medications. We work a lot with OCAN and the Obesity Action Coalition. And this year has been really active. A lot of progress has been made when, frankly, in previous years, there hadn't been a lot of progress. We're really excited to see that Ways and Means has marked up legislation. While it is not the original legislation that was introduced, it's been narrowed a bit. The bill that was passed by the Ways and Means Committee does allow for coverage of obesity medications for patients that are entering Medicare. So if you are a patient who has had commercial coverage of your obesity medication, say for a year before you enter Medicare, so you need to be continuously covered for continuity of care. That bill would allow Medicare beneficiaries who've had previous coverage to continue their coverage. It is not as robust as I think a lot of people had hoped, but it is a very, very significant step in the right direction to getting medications covered to treat obesity. And we're really excited about the fact that it may, fingers crossed, have some potential for inclusion at the this year, end of year, if Congress decides to do a package of policies that they move forward. So the other bill that has gotten a lot of attention this year, and I think people are really excited about it, is the Medicare Multi-Cancer Early Detection Screening Coverage Act, which is a mouthful. People also just call it MCED, M-C-E-D, MCED. This is a bill that would allow for Medicare to cover tests. So these are simple blood tests that detect whether a person has cancer in their body. And a lot of these tests are really interesting because not only will they detect whether you have cancer in your body, but where in your body. So this is really exciting stuff. And, from a cancer moonshot perspective, if you really want to advance the cancer moonshot, this kind of early detection is going to be incredibly important. So we're really excited that this bill has gotten some attention in committee, and that it's potentially going to allow for tests that have gotten FDA approval to be covered by Medicare. So next, we have the Saving Access to Laboratory Services Act. This one has been addressed a little bit. Last year during the appropriations process, Congress essentially fixed the payment rate for clinical labs so that they did not see a reduction in their payments as part of the appropriations process. The problem has not been solved long-term, though. So every year, until Congress fixes this problem long-term, they're going to have to figure out how to prevent these kinds of lab cuts year to year. The reason that this is important is think about when you go to get any kind of test that has to go through a lab, whether it be a biopsy or otherwise, there's a tremendous backlog in clinical labs. Without sufficient payment rates, we could expect that to get worse. Also, think about if you're in a rural area, there's very limited access to clinical labs. Not paying those labs enough only exacerbates the problem of access, particularly in rural areas. So this one has been on our radar for a really long time. Protecting Healthcare for All Patients Act, HR 485. This one is a little bit bigger than a 30-second soundbite, but in essence, what this bill does is it prevents payers from being able to use discriminatory value assessments to make decisions about reimbursement and coverage. In the past, we have seen Congress legislate and ban the use of these types of value assessments in Medicare. There was a provision included in the Affordable Care Act. What this bill does is it extends those protections for patients to other federally funded programs. So think Medicaid. And that would allow, so it basically extends the protections that are already in Medicare into other programs. This is important, as many of you may have experienced in the value assessment space, that when entities do these types of value assessments, they often do have a significant impact on whether a payer will A, cover the treatment, and B, whether they subject it to intense utilization management. So we're really excited. This has been a big priority for Kathy McMorris Rogers on the House side, especially because she has a son with Down syndrome. And so to the extent that these value assessments discriminate by devaluing a year in the life of a person with a disability, she really has made this a big priority and got this bill passed in the House. But we're really hoping to see some support in the Senate now. I know many of you probably have benefited from the telehealth protections that were part of COVID. During COVID, Medicare opened sort of the door to allowing for increased use of telehealth covered by Medicare. So those restrictions that were removed now need to be extended. There's been a lot of attention on Capitol Hill to this issue. In fact, just recently, the Telehealth Modernization Act did pass the Energy and Commerce Committee, so yay. But there still is a lot more work to be done to get this done. It is a must. I would call this a must do. It's a little bit like the Saving Access to Laboratory Services Act, SALSA. These are the types of bills that have to get done by the end of the year, or you will see those protections expire. So the Safe Step Act is probably one of the most talked about bills on Capitol Hill. It's widely supported by patients and patient groups. It is a bill that would essentially tell payers, we're going to put some limits on the extent to which you can use step therapy. Step therapy being a payer says to you, patient, I am not going to cover this drug for which you have been prescribed until you take another drug and it fails. As you can imagine, that kind of policy really gets in between the doctor-patient relationship and leads to significant adverse health outcomes in cases where drugs fail badly and patients continue to get worse with whatever condition that they have. So we're really excited that this bill is getting so much attention. It has been tied to something called pharmacy benefit manager reforms, PBM reform. This is a big hot topic here on Capitol Hill right now. It's a big question mark whether Congress will advance pharmacy benefit manager or PBM reforms that include this particular provision, the Safe Step Act, at the end of the year. So we're keeping our fingers crossed that it does get handled. So another bill that we've worked really hard on is the Medical Nutrition Equity Act. The Patients and Providers for Medical Nutrition Equity has been a tremendous coalition for advancing this bill and getting people up to the Hill to talk about their personal experiences. I have participated in some of these Hill days, and the stories are they're sad, right? You're talking about parents of children who are trying to get not just the right food to their children, but this is medically prescribed food without which patients who have these certain conditions cannot survive. So it's bigger than going to the grocery store and buying healthy food. We're talking about here with this bill, we're talking about medically necessary foods that are prescribed to patients and that are needed in order for them to live. So it's been this bill has been talked about a lot. It's a very broad bill, impacts commercial payers in addition to all federal program payers. But I think what we're gonna be seeing is a lot of playing with this bill to potentially narrow it to get it through the congressional process. We're watching this very closely and are trying to be part of that conversation. We were also really excited to see that Representative Velasquez over on the House side reintroduced the Liver Act, the Liver Illness Visibility Education and Research Act. As some of you may remember, this bill's been introduced for the last two Congresses. It also had been introduced by Senator Duckworth. We're really hoping that she's going to reintroduce this bill in 2025. GLI had a lot to do with helping to draft this bill, so it's personal, and it's a great bill, brings a lot of attention to liver disease issues, really gets into, what kind of liver cancer prevention activities are happening, tries to increase the focus on research. So very important bill for bringing more attention to not only the impacts of liver disease, but prevention. So another bill that GLI has traditionally supported is the Living Donor Protection Act. While this bill has not gotten any committee action yet this year, it is a bipartisan bill. We're really excited about it. We do hope that it gets reintroduced next year. It would prohibit insurance companies from denying or limiting coverage and from charging higher premiums for living organ donors. So, we heard a lot about this at A3 just recently. A lot of the patients that came to Washington to advocate, there are people out there who really would love to be a living donor, but they aren't necessarily supported by their employers to do that. So the question becomes, can they get healthcare coverage as a living donor? Would they be able to get the time off of work to be a living donor? So a lot of questions, and what this bill does is try to protect living donors so we can get more living donors out there to help save patients who need their organs. So it's a really great bill. We're excited about this one and really hope that it gets reintroduced next year. So we're excited about the Old Drugs New Cures Act because it would carve out an exemption for priority research drugs from the Medicaid line extension, allowing for a smoother path from drug development to patient access. So this basically ensures that the drug has a new indication that addresses a significant unmet medical need because there's no FDA-approved alternative for the indication at the time of the request. The goal here is to allow companies to know that when they do the research and innovation to get to this new indication, that they won't be treated like a line extension of the drug that still gets the same rebates as the existing drug. So we're really excited about the Hepatitis C elimination program. A couple of years ago, the president's budget included what's called the Hepatitis C elimination program. That included accelerating the availability of point-of-care diagnostic tests, something which is a really big deal now because there is one. Provide broad access to curative hepatitis C medications through a subscription model, advance comprehensive public health efforts to engage, inform, identify, and treat people with Hep C, reduce liver cancer. You really cannot achieve the cancer moonshot if you're not reducing liver cancer, and hepatitis C is the biggest contributor. So we really need to take hepatitis C seriously. Right now, as we understand, Senator Cassidy is collaborating with the White House. You may remember Dr. Francis Collins, who's now at the White House, was at NIH. This is a significant priority for Dr. Collins as well. And while we're watching this very closely, the latest news is that there is some draft language at the Congressional Budget Office that's being worked on, and we're really excited, with our fingers crossed, hoping that we'll see a bill very soon. So no bill introduced yet to advance the president's proposal, but potentially a bill coming soon. When that happens, we will absolutely be in touch, because I know that we're going to want to be supportive and involved, and are certainly going to want to be hearing from you about it as well. So appropriations has been difficult, to say the least, in the last few years, which I'm sure many of you have read in the news. I'm going to start with the good news. So in the appropriations world, we're very excited to see, there was increased funding for the CDC's viral hepatitis program in the House bill, $10 million more. That's great. What's on this slide is the report language. So there's typically what we call report language that accompanies any appropriations bill. There's a significant amount of report language in the bills that are being advanced on both the House and the Senate side to bring attention to conditions that we care about. So trying to bring attention to the need for obesity drugs to reach patients, language that encourages the NCI, the National Cancer Institute, to advance a national agenda around liver cancer, looking at medical imaging, looking at NIH to develop novel treatments for biliary tract cancers, recognizing all of the challenges related to hepatitis C, and recognizing liver disease as the 9th leading cause of death in the United States. So there's just a lot going on in these bills that clearly brings attention to liver disease. What I would caution, though, is that, other than this bump up over in the House related to viral hepatitis, even more so in the House are cuts to a lot of the healthcare programs that we care about and that advance prevention and research, particularly with NIDDK, which is the area of NIH that funds liver disease research. There's significant cuts. So last year you may have seen that we had a call to action to support the Senate levels of funding. By and large, I think we continue to support the Senate levels of funding for programs because they're much more generous than what we're seeing on the House side. But wanted to share that, there is some good report language too in all of this that is a positive. So, just to kind of wrap it up, I know you're going to be seeing from the GLI team calls to action associated with this presentation, where you can go in and click a button, write a letter, reach out to your member of Congress. We really, really hope that you will do that because there's a lot going on in Congress right now. September was a very busy month for Congress because it was their last chance to get some movement on a lot of these bills that we've talked about. The expectation at the end of the year in November after the elections is that they will have to deal with appropriations because the current fiscal year ends at the end of September. But we really hope that in November, and what is traditionally called a lame duck session, so that's after the elections and before the new members are sworn in January, there's a lot of hope that there will be some piece of legislation that allows for some of these bills to get done this year. I can't promise you that's going to happen. There's a lot of speculation about whether or not it will happen. But October is going to be a really important month to weigh in with your members of Congress, because the bills that we just talked about and whether they are included in such an end-of-year package, it's really going to be influenced by your advocacy today. So we're really excited to share this information. Again, please reach out to us if you have any questions. And we're excited to share with you the information about how you can do a call to action, whether it be to the Prevent Cancer Foundation to talk about the Medicare cancer screening bill, or, connecting with the obesity coalitions. We're really proud to be part of the coalitions that are trying to, make our voices louder to get these bills passed. So more to come, but very pleased to have done this presentation and welcome questions. Thank you.